So we're going to talk today about recovery from a lipo-abdominoplasty or a liposuction tummy tuck. So the thing that's great about this surgery, because it's done with tumescent anesthesia, you're real comfortable. And that tumescent anesthesia lasts for about 18 hours after this surgery is performed. From the lidocaine effects and the vasoconstrictive effects, well, they wear off a lot sooner, but they're very prevalent during the surgery. So you're very comfortable. This is usually done in an outpatient setting, although you do have options here at my practice at Sarasota Surgical Arts to either stay overnight with my nurse, or we can send you to a facility or the hospital itself, depending on where you're most comfortable. But most of my patients, 90% plus of my patients, actually go home that day, because I think it actually is better because they're up, they're moving around, less risk of chances of getting blood clots or any major complications if you're moving around, moving around after a surgery. So what could you expect in terms of pain? Most patients have probably 2, maybe 3 days of some discomfort from this type of surgery, but it's really well tolerated because of the tumescent anesthesia. So you're real comfortable after the surgery for the first day and a half, and then usually people start having a little bit of discomfort by the second to third day. Now, by the second and third day, as long as you're past the first 6 hours of the surgery, your pain is going to be a lot less. So people tend to recover from this type of surgery very quickly. It's very well tolerated, and the results are really great. Like I said, you're able to liposuction, get the contour, as well as keep all the blood supply intact from doing the liposuction. You get great contour, great flat belly, minimal downtime. Most people are back to work within 7 days or so. Most people are up, moving around, walking around that day after surgery, and definitely back to some minimal chores the next day. I usually have my patients don't wash that area for 1 week, and I don't use any sutures on the skin. I do use skin glue to seal the incision, and that usually keeps it covered for about 7 days, sometimes 10 days, but that falls off on its own. But I found that really reduces the amount of issues, infections, and potential complications with skin wound healing by using the skin glue, which is a great little additive. So if you're thinking about getting a lipo-abdominoplasty, do it. It's a great surgery, minimal recovery. I think you'll be surprised at how easy it'll be.